Good evening and thanks for joining us on this Friday. We begin tonight with a growing nightmare, struggling to feed the youngest members of our families as more stores place purchase limits on formula. That is, if they have any on their shelves at all. Supply chain issues and one of the nation's largest formula manufacturers temporarily shutting down, causing the U.S. supply to shrink by more than 43%. While the Biden administration says it plans to import more formula and crack down on price gouging, the White House communications director says there is no timeline for when this shortage might ease up.
It's not about assessing how quickly we're going to be back to a certain level. It's about putting our heads down and doing everything we can to work with these manufacturers. We are working to do it as quickly as possible. I'm not, I'm not going to stand here and tell your audience that I can give you a hard timeline that I can't give you.
The House Oversight Committee is now launching an investigation into the shortage. But here at home, as the search for formula has many families in crisis mode, 7 News senior reporter Eileen Buckley takes a look at how your local and state leaders are figuring out ways to help.
I think for a mom, it's a crisis.
Many families are scrambling to find baby formula that has disappeared from store shelves in the midst of a nationwide shortage. Social service agencies such as Women, Infants and Children, known as WIC, are trying to help eligible and low-income families find formula.
And if they're not finding it on the shelves, they need to go to the customer service desk because their stores are limiting the amount that people can purchase, right? Because they don't want families to go in and buy 10 cans of formula and then somebody can't even buy one to provide nutrition for their child.
WIC families can also talk to their healthcare provider who can list 2 infant formulas on their medical documentation.
If the baby's on a specialty formula and they're not able to find it in the store, if the healthcare provider had already listed 2 different formulas, all mom would need to do is call the WIC office and we would be able to change her benefits on her EBT card.
And no infant should ever have to go without basic nutritional needs.
Lawmakers on both sides of the aisle are trying to figure out what they can do to help. Erie County legislator and Republican Minority Leader Joe Larigo filed this resolution Friday. If approved, it would call on the county administration, health department, and purchasing department to discuss any way it might be able to assist the community, much like it secured PPE during the pandemic.
Whether or not we could purchase baby formula in bulk and then, provide it to Erie County residents at our cost, just to sort of help people in this, time of need where they don't have the same access to formula that they normally would.
A spokesman for the county executive's office says the county does not provide formula at this time, and also noted even President Biden is having trouble procuring formula. Republican state lawmaker Patrick Gallivan and Democratic Assemblyman William CONRAD say they're not sure how they can help, but will do their best.
We all seen those pictures of the shelves empty, and it scares the hell out of me. And my heart goes out to those families facing that crisis right now. And if there is anything to do, I will certainly pursue it.
I think among the things that the state is looking at is whether or not it's appropriate for the state to try to pursue a supply, especially for those that are in need, that they may be able to assist with the distribution, but I just don't know that we can get to that.
On Thursday, Governor Kathy Hochul announced resources for families to help deal with the infant formula shortages, suggesting women call their OB/GYN or medical provider to see if they have samples. A Buffalo pediatrician told me when it comes to specialty formulas, they don't have as much as they usually do. And she is not sure if they can get more when they run out, but are trying to do their best to support the most vulnerable patients. Eileen Buckley, 7 News.
Such a crisis. If you are struggling to find formula for your child, there are resources available from the local to federal level. In our region, All Babies Cherished and Feed More Western New York offer formula through their infant assistance programs. And the White House just this afternoon launching a website with resources to help you find formula there as well.